Hey everybody, Dr. Joan Ifland here. Did you know that anxiety and depression can be put into remission, even if you've been told that it's a chronic condition that cannot be cured and that you have to be on medication for a lifetime? Think very carefully about who is giving you that advice. Is it somebody who is dependent on pharmaceuticals to treat health conditions? If it's somebody who's dependent on pharmaceuticals to treat, then you're very likely to be told that anxiety and depression can only be treated by pharmaceuticals. But I'm here to tell you today that anxiety and depression are seen by researchers as very different than are seen by practitioners. Researchers are saying that anxiety and depression are very complex conditions. They have a lot of causes, and we're going to talk about them today. But you can untangle them. So whether you're being told anxiety and depression is an incurable chronic condition for which you must take medication for decades, or whether anxiety and depression are conditions that just have a lot of causes but can be untangled. Today, we're going to look at the evidence. Anxiety and depression are the most common types of emotional distress, but research shows that they have complicated causes. Today, we're going to talk about 4 complicated causes of anxiety and depression that can be untangled. Processed foods, of course, cultural pressures, trauma, and physical conditions. So how do we know that processed foods are associated with anxiety and depression? Well, we see in studies that processed food use precedes anxiety and depression. Processed foods shut down the parts of the brain that allow us to feel good. Processed foods affect neuron functioning. They affect how your brain works. And they elevate stress hormones like cortisol and adrenaline. So you might feel anxiety because you've got a lot of adrenaline in your system caused by processed foods. And it's not caused by life. I think this is exciting. It's exciting to find out that processed foods are altering brain function and you are feeling depression and anxiety, but it's not because of what's going on in the outside world. It's because of what processed foods do to your brain. Caffeine is associated with anxiety and depression. It dysregulates the gut-brain pathway. It dysregulates glucose, and anxiety and depression are associated with obesity, especially when it creates disabilities and immobility. And you have chronic illness, which is associated with processed foods and depression and anxiety. And then disease susceptibility, where you're sick frequently. These are all associated with processed foods on the one side and anxiety and depression on the next. Cultural pressures can create anxiety and depression, including work, television, especially for women, financial issues, social and media and entertainment they're associated with anxiety and depression. Sleep disruption is associated with anxiety and depression, as well as isolation and loneliness. So these are cultural pressures. If anxiety and depression comes from distress related to the culture, how is a pharmaceutical going to help you? And not for remission. All right. Cultural pressures can also come from social stigma. We do know that this culture is brutal for people of certain body shapes. Relationships, medication side effects So this is something you may be taking a medication for the side effect of a processed food, and then that medication creates the anxiety and depression. Climate change is also associated with anxiety and depression, as are video games. You have all these things going on around you, and until somebody just starts to untangle them, you have no idea why you feel depressed and anxious all the time. But the researchers are on this, and the researchers can tell us what the causes of anxiety and depression are. All right, so you're here, we're here together, we're understanding this. Trauma can also be a cause of anxiety and depression. Adverse childhood events, domestic abuse, work abuse, and violent entertainment. These can create anxiety and depression. Is the medication going to help, or is going back and healing the trauma going to help? That's the question. Anxiety and depression can also come from physical conditions. So we know that processed foods create a lot of different diseases because of the way they make cells dysfunctional. So if cells are not working, you can have a lot of different diseases. Pain, inflammation, inflammatory bowel, weak muscles, and lack of mobility can also all contribute to depression and anxiety. So if you have depression and anxiety, I hope that you're getting some hope. Well, yes, maybe it's a long list of causes, but they can be untangled if you know what to do. And of course, you've got to get around the right people to do it. Skin problems can cause anxiety and depression, frailty, heart disease, prescription side effects we talked about, and obesity. You know, you can untangle those. You don't have to depend on a medication if you can get into a program that untangles the depression and anxiety causes. So this is where we come out with the depression and anxiety. The evidence suggests that anxiety and depression is actually the complex consequence of processed foods, cultural pressures, trauma, and physical conditions. There you have it. That's the research. All right. Now, one thing I want to make very clear to you is that anxiety and depression is not your fault. We know that when the tobacco companies came in the mid-1980s and they bought Kraft, Nabisco, and General Foods, they brought their addiction business model with them. It is associated with a lot of physical illnesses, some of the cultural pressures, and trauma. The trauma of having a severe disease and then being told it's your fault and no treatment for it, for example. So this is not your fault. And you should never let anybody blame you or shame you or criticize you for having anxiety and depression. You did not ask for this, and you're not cooperating in its presence in your life. All right, so let's find out why nothing has worked. What is it about medication? We have limitations not just to medication, but to talk therapy. And then we need to talk about why you should not give up. All right, here we go. This is a very interesting quote. It comes from the Mayo Clinic website, and I want to read it in full. I have to say, it's not the only thing that the Mayo Clinic says about treating anxiety and depression on other pages. There are other things to do for it, but this is the prevailing protocol in medical industrial practices. The medical industry says, because persistent depressive order is long-term, coping with depression symptoms can be challenging. A combination of talk therapy and medicine can be effective in treating this condition. Okay, let's take a closer look. Does medication work? Okay, here's another long quote from a study, but I want to give you the whole thing. Around 20 to 40% of patients with a major depressive episode do not exhibit clinical response to the current treatment with antidepressants. Even when remission is achieved, there's often a long way to recovery and to the patient's return to the prior state of occupational and social functioning. Moreover, long-term medical treatment is needed in order to achieve and maintain the above. So you have a big part of people suffering who don't respond to medication. It's a long road. It takes a long time to recover. Here's another quote from a good study, Lynn, 2023. Serotonin medications share common limitations such as slow onset and low efficacy. Many patients do not reach their treatment goals with the first antidepressant or may continue to have symptoms of depression after treatment. So there's the evidence for whether medication works for anxiety and depression. Now, how about weight gain and sexual dysfunction as side effects of medication? Here is a list from the website of the National Health Service of the United Kingdom. Side effects of SSRIs and SNRIs. These are serotonin focused antidepressant medications. Feeling agitated, shaky, or anxious, feeling and being sick, indigestion, stomach aches, diarrhea, constipation, loss of appetite, dizziness, not sleeping well, headaches, loss of libido, difficulties achieving orgasm, difficulties maintaining an erection. Now, they say that these side effects should improve in a couple of weeks. It's a lot to go through for something that the evidence suggests just might not work. There's another kind of antidepressant called a tricyclic. The common side effects of this one are dry mouth, blurring of vision, constipation, problems passing urine, drowsiness, dizziness, weight gain, excessive sweating, heart rhythm problems, and then, yes, the side effects should go away after a couple of weeks. My gosh. Now, serotonin syndrome. You could have an allergic reaction to serotonin and have a confusion, agitation, muscle twitching, sweating, shivering, and diarrhea. You know, these lists make you wonder, like, am I better off? How am I better off? Let's talk about antidepressants and diabetes. Long-term use of SSRIs and TCAs, the two primary kinds of antidepressants, has been linked to an increased risk of developing type 2 diabetes. And then suicidal thoughts can come with these antidepressants. All right, let's look at the limitations of talk therapy. So now we've seen the evidence that cultural pressures and processed foods, as well as trauma is addressed by talk therapy, are associated with depression and anxiety. So great, you go and you talk to a therapist for an hour. Well, what about the other 167 hours of the week? You leave that therapist's office, you go right back out into the cultural pressures, you go right back out into being driven crazy by cravings for processed foods. So how can talk therapy really address the whole syndrome. We're also going to see some evidence in a little while that community is the answer to anxiety and depression, very particular kind of community, lots of kindness. And talk therapy doesn't give you community. It gives you one other person once a week, or even less often. All right. But what should you try again? Maybe you've been told that it's not going away, it's not curable. What happens if you just give up? And you say, well, I'm just going to live with this depression. I don't want the side effects of the medication. Talk therapy is not working for me. So should you just give up? No. So the answer is no, because depression itself has side effects. Obesity, diabetes, insulin sensitivity, glucose regulation, poor glycemic control. The endocannabinoid system is disrupted. You have hormone disruption. And you have particularly the stress hormones, corticotropin and corticosterol release. You have risk of disease. So depression is associated with cancer, dementia, diabetes, epilepsy, stroke, and inflammation. It's associated with blood pressure, heart rate, norepinephrine, sympathetic tone, vascular resistance, blood viscosity, plasma volume, and atherosclerosis. So you can't just let it persist. But the good news is that you can untangle it. All right. So we just come to a summary of the evidence. The evidence is that processed foods, trauma, cultural pressure, and illness are the complex causes. So the answer is finding a healthy counterculture. You are beginning to get the idea, perhaps, that the research is showing you that it's the culture that's creating depression and anxiety for you, especially the processed foods in the culture, and that finding a different culture could be super helpful. So let's talk about finding a different culture. So I will just stop here and say we have created this culture online, and I'm going to describe it to you, and you'll see that it is exactly a match for what research shows to be the causes. Ready? Manage anxiety and depression triggers constant access to kind, caring people, and revealing and fighting against specific food industry practices to manipulate you to eat the processed foods. So let's look at the evidence. What we're really focusing on here now is which is better, to take medications, do the industrial and the medical industry, take the medical industry route, or try something different, resolve the root causes. Now, these are some shocking studies, and I'm going to quote from them pretty extensively, but I want you to have the full impact of these studies. The lead researcher on this one, his or her name is Coventry. It was published in 2020. This is a relatively recent study. Compared with pharmacological interventions, psychological interventions were associated with greater reductions in PTSD and depression symptoms and improved sleep quality. Sensitivity analysis showed that psychological interventions were acceptable with lower dropout rates, even in studies rated at lower risk of attrition. So here's your first indication that a psychological intervention is more effective than medication. What we're doing now is not working. We know that rates of depression and anxiety are increasing, and so we know that what's available out there is not working. We now also know that depression is contagious. Oh, depression is contagious. Well, that means it's crucial. It's absolutely essential that you be around people who don't have it. If depression is contagious, then recovery is contagious too. Depression comes from loneliness. And we know that after COVID, a great deal of more people around the world are feeling lonely. A majority of Americans live by themselves now. So if you can find an online community, and we are going to share about our own online community, your loneliness can be just evaporated like as soon as you enroll. Like, I'll just give you a little hint. Our community is on live with kind, trained, uplifting hosts, 15 to 17 hours a day. We send out a 1-hour podcast every day. We have a huge library of videos, most of which I've recorded. And the idea that you can be no longer lonely just by joining an online community, the right one, is really, I think it's exciting. So one of the big factors in anxiety and depression can be dealt with like just by registering. It's so exciting. We know that health, mental health especially, can be delivered over screens. Telehealth has now been proven. So you can join an online community. You don't have to get dressed. You don't have to turn on your camera. You can listen. You can turn it off when you're tired of it. You don't have to take any risks. The people there are just waiting to cherish you. It's what the community is about. So finally, it's easy to find a group of really healthy friends and get yourself into that mindset. Now, this is another quote. I'm going to read you this quote. I just think this is the most beautiful thing. The researcher is O'Neill, and this study was published in 2023. Get ready. A culture of companionate love can be a protective force against the negative outcomes of an emotional culture of anxiety. So what you're looking for is a culture of companionate love. This is love between friends. So what works? Now we're going to get into the studies of what works. Group-based social activities, support groups with educational elements, recreational activities, training or use of information and communication technologies. Oh, well, that makes sense. Connecting with other people who are cherishing us, being kind to us. Well, then we start to cherish ourselves and be kind to ourselves. That's the opposite of depression and anxiety. So you just keep coming back to the same evidence. Depression and anxiety is a complex condition. Medication and talk therapy have limitations. A companionable online community has been shown to work. All right. What does that look like? What does that companionable online community look like? Well, it helps you eliminate processed foods. If people around you are not eating processed foods, your brain will want you to be normal, and it'll make it easier, much easier to eliminate processed foods. Eliminate cultural pressures. You're not under pressure to participate in a stress-filled culture if you have 24-hour access to a companionable culture. You gain skills. It takes a lot of skill to live in our culture, be healthy, be vibrant, be optimistic, and be different from people who are depressed and anxious. And then we have seen over and over again, there's lots of evidence for why this happens, but a lot of physical illnesses go into remission when you're in a kind, supportive culture and you're eating clean food, non-processed foods. All right. So if you can stay just a few more minutes, I would like to talk to you about the Remission Optimistic Community. A team of wonderful people from the ARC, which has been our 5-year community for remission of processed foods, cravings, and addiction. We have put together an online community, very based in research, the kind of research that we've just been looking at. And it's called the Remission Optimistic Community. So what does the evidence show? Eliminate processed foods. Deprescribe medications that you don't need anymore, that your prescriber has to deprescribe. We are not going to do that. Your prescriber has to know how to deprescribe medications that have depression and anxiety as a side effect. Resolve trauma. When you're around people who cherish you, trauma seems to just lose its grip. Protect against those cultural pressures and decrease pain by removing those processed foods. Now, here is another quote from that incredible study by Coventry, 2020. Interventions that included skills-based strategies, along with trauma-focused strategies, were the most promising interventions for emotional dysregulation and interpersonal problems. Well, that's the Remission Optimistic Community. What is it? What does it provide? 24-hour comfort. You have a Facebook group that's on 24 hours a day. You have a library that's on 24 hours a day. There are lots of private messenger groups that are monitored periodically. It's not constant, but there are people watching over them and responding. There are a lot of explanations for the why this is not your fault, why other things don't work, why this does work. There are dozens of skills taught in the Remission Optimistic Community for managing mood, managing emotions, managing thoughts, managing behaviors, managing relationships, managing sleep, managing stress, managing protection from the processed food industry. These are skills, hard skills. This happens, I do that. It works, I'm okay. Opportunities to train to help others. A lot of people can snap out of their own depression when they get into that mode of helping the next person. And we do have the best training because I am a leading researcher, maybe the world's leading expert in recovery from processed foods. This is the textbook, Processed Food Addiction, which I wrote full-time over 3 years. It's based on 2,000 citations. So you're getting expertise. This is not an amateur organization. All the hosts are trained. We offer the training, and then you can join that training and learn how to help the next person while you're helping yourself. And then also access to healing modalities that are beyond the medical industry. I'm going to give you this incredible quote. It's from a book called Healthy No Matter What. It's written by a doctor who's associated with the World Health Organization and a philosopher, his daughter. Here's the quote. Rarely are patients given options drawn from the 90% of the choices found outside the medical industrial complex. So these authors are saying the medical industry only offers 10% of the choices for healing disease available out there. And the Remission Optimistic Community gives you tons and tons of opportunities to try out other modalities like breathing exercises, meditation, visualizations, qigong, and even things like singing bowls. There are lots and lots of things that other cultures in other time periods have found work great to put illness into remission. And so why not be in a community that's trying them out? And then trying things out will be normal to you. Clean eating also needs to be made normal. If you're around people who are eating clean and getting the benefits from it, your brain will be comfortable with you eating clean. But if you're around people who are eating processed foods, 73% of the calories consumed by Americans are processed. So if you want to eat clean, you have to put up with being abnormal. And nobody likes being abnormal. But if you're in an online community where people are eating clean food, then you can feel normal and do it for the rest of your life happily, and even influence the people around you to start eating like you. So what would you gain by joining the Remission Optimistic Community? Processed foods are associated with a broad range of physical, mental, and emotional problems. So you might find that even things like skin problems, gut problems, diabetes, heart disease markers, fatty liver, fatigue, that these things also go into remission. There is evidence that those problems, including cancer, are associated with processed foods and stress. So when you get into a community that is eliminating processed foods and stress, you have a whole new life. You have a whole new opportunity to be free. Be free from labels. Nobody likes being labeled a diabetic. Nobody likes being labeled a depressive. Nobody likes those labels. So if you really get at the root causes in a community that is also getting at the root causes, you have a real chance. It's so exciting. So there's a daily schedule in the Remission Optimistic Community. You have 2 health creation meetings with a live trained host a day for 4 months. So that's 18 weeks. Monday through Sunday, 7 days a week, you are meeting twice a day to create health in a small community. So the Remission Optimistic Community is 25 members, and you get to know them. They get to know you. You are just surrounded by wonderful people on the same path that you're on. You can choose from 4 hours a day of healing modalities. You are always with a trained advocate. You have an extensive resource sheet if you want to get help outside the rock. And you have this rock Facebook group. Now, for example, I'm going to take myself as my own example. I joined the first rock as a member, as well as a leader, to put lifelong asthma into remission. As I'm recording this, I have been in my rock for about 2 months and 2 weeks. I am breathing deeply for the first time in my life. My chest has opened up, my lungs have opened up. I had to do a lot of different things. High on my list was resolving childhood trauma. I was raised in a traumatic household, and I had a lot of different fears, and my body was trying to hold me quiet so I wouldn't be discovered and experience more trauma. So I had to do that. I had to learn how to get up from my desk. I had to address my workaholism. But because I was in a group of people and I was meeting with them a lot, I saw them a lot, my brain began to prioritize what they were doing, and they were taking care of themselves. And now I'm taking care of myself. And I am breathing deeply for the first time in my life. Exciting. All right, so we have other people in the community who are putting diabetes into remission, irritable bowel into remission, high blood pressure into remission, again, depression and anxiety. These are things that I am seeing. We're not representing that it's going to happen to you. We're not guaranteeing anything, but I am sure excited about this, I will tell you. All right. You decide how much to participate in. Even though there is, the schedule runs about 12 hours a day. It's all online. It's very convenient. You join in activities as you feel you want to. Nothing is required. We trust you. We respect you. We're going to put all of this in front of you, and then you're going to pick out what works for you. It's really fun. And if you don't need support on a particular day, you don't open your screen. So again, let's look at the special things that we do for depression and anxiety. Cognitive restoration, resilience training, compassion, expanded providers. So I did not do this in the rock alone. My miracle, I engaged an outside therapist for kind of the heavy lifting of the emotional release that I was looking for. And I had an outside acupuncturist, a brilliant, brilliant acupuncturist who found the energy blocks in my body where I had just blocked because of the trauma. So it was a team effort and some really good friends. So online does work, Qigong, these things have all been shown to work. All right. So it's easy to follow videos. We curate videos. We do have videos from YouTube, but we have very carefully evaluated each one as being appropriate and helpful. Okay. So if you would like to learn more, please email us, gethelp@foodaddictionreset.com, gethelp@foodaddictionreset.com, or visit our website, remissionoptimistic.com, remissionoptimistic.com. Thank you so much for being here with me today. As you can tell, I'm super excited about the ROC, the Remission Optimistic Community, the ROC. And I just want you to be happy, to get into a community where you can unravel all the causes of anxiety and depression and just be free and happy. I will see you here